My name is Larry Corum. I'm a medical oncologist and hematologist at Olathe Health Cancer Center.
I'm Dr. David Lee. I'm a medical oncologist here at Olathe Health Services.
Medical oncology is a specialty that involves the diagnosis, evaluation, and treatment of cancer. Your medical oncologist will determine which labs, procedures, or imaging studies may be needed for proper diagnosis and which treatment would be best for your unique situation. Your medical oncology physician is an expert in systemic therapy, which may be chemotherapy, hormonal therapy, oral or intravenous targeted treatment, or immunotherapy.
Cancer therapy is changing. It's already changed. There was a time not so long ago where the only question asked about a tumor was, what type of cancer is it? Lung cancer, breast cancer. And the answer was, we treat lung cancer with this, and we treat breast cancer with that. But we know that lung cancer is not one thing, and breast cancer is not one disease. It's many diseases. And so, in order to treat many diseases, you need many therapies. And when it comes to cancer medicine, there are two major considerations: the patient and the cancer. And I make a distinction between those two because they're not the same thing. And so we need to understand the features and the characteristics of that patient, and we need to understand the features and the characteristics of that cancer. And so instead of the old question, what type of cancer is it? We can ask new and more interesting questions, and the answers are more powerful than ever before. And the way that we understand the features and the characteristics of that cancer is through broad molecular testing. We can understand if that cancer expresses certain mutations. We can understand the presence or absence of certain proteins. Maybe we do a genetic profile on the patient to understand some of those pieces of information. And we can synthesize all of that to create a much more specific treatment plan. So instead of old school chemotherapy, which is more of a kill everything that moves approach, we can design a much more specific treatment with a targeted therapy. That cancer has a certain disposition, a certain personality, a character, and we can understand what makes that cancer do the things that it does. And we can address those things now in a way that we never could before. And that's because of an increased understanding of molecular biology, protein chemistry, drug development, genetics. All of these things have come together over the last couple of decades, and it's becoming actually clinically useful. I'm seeing a patient in clinic this morning with lung cancer. 10 years ago, we would have said, you have lung cancer, I know you're a never smoker, we don't know why this happened, we're going to give you chemotherapy. And she may have had a response, she may not have had a response, she would have had some toxicity almost certainly, and she might have lived a year, maybe. What I know now about this patient, because we did molecular testing, is that she has what's called an ALK gene rearrangement. And we have a specific drug for patients with an ALK gene rearrangement. Those patients respond much better than they do to traditional chemotherapy. They have much less in the way of toxicity, and they do tremendously better than ever before. And many of those patients are living for many, many, many years with metastatic lung cancer. And that wasn't possible before.
The first step toward healing is an initial consultation with your oncologist. Once you've checked in at the front desk, a medical assistant or medical oncology nurse will greet you in the lobby and bring you back to an exam room for a brief history and vital signs. Next, you will meet with your medical oncologist, who will perform a physical exam and review your history, labs, and diagnostic tests. Together, you will develop a treatment plan designed specifically for you. If an infusion or injection will be part of your treatment, you will likely visit our on-site laboratory. The laboratory technician will draw your blood and ask you to wait in the lobby while your labs are being processed. Lab results may take 20 to 60 minutes. Once your lab results are complete, the pharmacy will be notified to make your medication. This process may take approximately 45 minutes. Your medical oncology nurse will get you settled into an infusion suite and will start your medication once it's ready. Your time in the infusion suite will depend on your individual treatment plan. You are welcome to bring one visitor with you. Please, no children under the age of 15. You are invited to bring lunch and snacks with you during your infusion treatment. There is no on-site cafeteria, but we do have a cantina located off the main lobby with snacks and refreshments. Here are some reminders about what to do before your treatment in the infusion area. If you will be receiving chemotherapy, please eat breakfast or lunch depending on the time of your infusion. It is advisable to avoid anything too greasy or spicy. Take all your normal medications before coming to the infusion center. Bring any necessary medications with you, such as an inhaler or pain medication, since these medications are not always readily available at the cancer center. Please make your nurse aware of any supplements, including vitamins, you are taking, since these can influence the effectiveness of some cancer treatments. We are here to help, so please ask us anything.
So what I would say, and what I do say to a cancer patient newly diagnosed, is even though I've been doing this for approximately 20 years, I still understand the impact and the importance of a cancer diagnosis. And I think that's really important. You know, this is not a situation, at least for me personally, this is not a situation where, oh, I see cancer patients every day and I become numb to it. You know, it still hits me pretty hard when I see a person, whether they're 20 years old or 90 years old, who gets a heavy diagnosis like cancer. And so I always remember, hey, this is a major change and a huge impact for this person. And so I always try to walk people through, you know, what does it mean and what can we do about it? You know, what are the realistic choices? You have to individualize though, right? We don't do cookie cutter medicine where everyone gets the same treatment. It depends on, you know, the person's underlying medical problems, you know, their age to some extent, and obviously to a great extent what they want to do, but we walk through that in a very individual way with each patient. But the main thing for me is for patients to understand that this is not just another case for us.